Good afternoon, and thank you for coming. And I think we're probably between holding you back from drinks very shortly. So, so we'll make this quick and fun. My name is Phyllis Marshall. I'm the Dean of the School of Nursing, W. Carey Edwards School of Nursing at Thomas Edison State College in Trenton, New Jersey. My partners here are Dr. Karen Abate. Karen is a nurse practitioner and a mentor content expert for us at Thomas Edison State College. And she is also a family nurse practitioner at One Medical Group in New York. Also on the stage here is Linda McCafferty, and Linda McCafferty is the technical training manager at Lockheed Martin Corporation. Okay. All right, you got that. The purpose of our program this afternoon is really to share with you the process we use for the development of a virtual clinical experience in our graduate nursing programs at Thomas Edison, using an interprofessional team of the content expert nurse educator and our instructional designer. Okay, just a brief introduction about Thomas Edison. We are one of the state colleges, one of the 11 state colleges in New Jersey. We're one of the first schools in the country designed specifically for adults. The mission of the college is really to provide flexible learning opportunities for self-directed adults. We were the first school in New Jersey. We have more than 20,000 students from all 50 states and 70 countries around the world. The nursing program has been around since 1983, was transitioned to an online program in 2001. We have more than 2,500 students enrolled from across the United States. We are all online. Well, I would say mostly online. And we offer courses every 12 weeks, quarterly basis. We are one of the largest nursing programs in the country. Our programs include, we have an accelerated second degree nursing program, which essentially is a hybrid program. Students who have college degrees come, they have classroom experiences on campus as well as clinical experiences. 35 credits are earned on ground, 25 online in the span of 1 year. They go through 4 terms. The RN to BSN program is our largest program. This is where nurses from associate degree and diploma schools come to complete their degrees. Just a quick show of hands. Anyone here nursing faculty? Okay. And then we have an RN to BSN MSN program where students come in, they go through, right through to the master's degree. Those programs are all online. Our master's is in, we have a nurse educator program, nursing informatics program, and nursing administration program, again, all online, as we also have graduate nursing certificate programs in that area. We embarked on this journey of simulation. Since we're an online program, you would say, well, what do you need simulation, if you don't have any on-ground students. In preparation for our on-ground program, we worked with Lockheed Martin, who are experts in simulation, to help us design and build our simulation center. And out of that experience and partnership, we moved into a virtual clinical experience for our online students. Because with our small program, we were reaching 30 students a year, but with our online virtual experiences, we wanted to reach the rest of the 2,500 online students. Again, history of simulation is really very, very powerful in the military and in aviation, as Lockheed certainly can attest to. And in healthcare, simulation's really been developed very well over the past 15 years. And it's more so being developed, and there's much more requirements for it now because there are so many healthcare students Clinical experiences are very limited. There's a call through the Institutes of Medicine and Robert Wood Johnson's Future of Nursing initiative to have students have interprofessional experiences. We do not have other healthcare programs on campus, and so this really helps us build in that interprofessional experience. Students who go to the clinical don't always get the kinds of experiences that they need. Okay. Then I'm going to turn it over to Linda, who can really talk to you about the actual building of the experience.
In a group that is instructional designers, programmers, graphic artists, and we create all types of simulated experiences, whether it's to repair an airplane, whether it's to learn to fly, whatever it is. But the idea is always that you have to take that student from where they are and bring them to a competent level, from a novice to more experienced. And because these are online students who don't have patients to interact with, it's going to help them prepare for their clinical experience by being able to interact with an online avatar. So that's the experience that the faculty there asked Lockheed to get involved with. So the most important thing, especially for such an applied type of graduate program, is to simulate the real experience. So here's an example of an electronic medical record where the nurse practitioner is going to read the diagnosis. It's going to read about this particular student. So, and then actually we're going to see Sage speak to us in just a few minutes. There's actual clinical data. You are trying to mimic the true life experience. The student, nurse practitioner student, is going to choose clinical treatment based on the diagnosis, and they're actually going to do what an actual clinician does. They're going to decide, from what I see, I'm going to give this type of treatment. Oh, it's not exactly producing what I thought it would produce. I need to bring that patient back in, and I need to get more information. I might need to run some additional tests. Applying critical thinking is extremely important. If you were here for the speaker beforehand, she talked about a lot of times students who are in an online situation are not engaged. You know, their phone might be buzzing, things might be popping up, but in a graduate school or in any type of real courseware setting or curriculum setting that you want them to really think about what's going on, you need to force them to use some of their critical thinking skills. So they're going to listen to what Joe is going to tell them. They're going to make decisions based on having to look at how his eyes look, to listen to his voice, to listen to his demeanor, and they're going to have to apply those critical thinking skills to make their diagnosis. This particular scenario was in a pharmacology course, and after they looked at the initial information about, they were supposed to determine, is it bronchitis, is it COPD, or is it CHF? Yeah, I have to have my nurse help me, right? My nurse practitioner. And so is it one of those? And actually, it takes them through the branching, and they're going to be told, oh, he's not getting better. Okay, so not every intervention works the first time, and because it's in this 24/7 accessible environment, those students can come on anytime to be able to see that. So what I'm going to do is just show you, since we're talking about online interaction, I want to make sure that you see sort of what the student experiences in the online situation.
My name is Joe Ryan. I don't feel well. I've been coughing for the last 3 weeks or so. I tried to take some over-the-counter cough syrup to help ease the pressure when I cough, but it just doesn't seem to be getting any better. I guess I have to go see my primary care provider.
In this case study, you will interact with Joe. You'll be provided unfolding specific information surrounding presenting symptoms, physical exam, and diagnostic findings. Follow the directions on the screen when you are making your choices to progress in the scenario. You will be given feedback surrounding the selections made in order to support the development of clinical reasoning and application of pharmacological knowledge relative to a clinical case study.
So we combined what we normally do in every type of military or commercial customer in terms of providing a simulated environment, providing testing interfaces. Those of you, with the academic background, we made sure that we weren't testing at Bloom's bottom level. We're not testing basic knowledge. These are graduate students, right? So all of our tests are very in terms of diagnosis, interpret, in terms of that higher level Bloom's taxonomy. And so the live courseware goes through. It's going to show the physical exam, diagnostic decisions, and there's feedback all the way through, allowing the student to really mimic what would happen in a more clinical setting, something that they were not able to do when they were working at a distance beforehand. Okay, this is another example, and this one is a little more dear to my heart because my daughter, too, is a type 1 diabetic. This was the first course that I worked on with the team here, and so it was nice to be able to kind of know that this was the first example that the students were going to work through.
My stomach hurts, I feel queasy, and I've been throwing up for over the last 2 weeks. My mom has tried to give me some drugstore stuff to make me feel better, but nothing is helping. There are other kids at school who've had a stomach bug, but they've all gotten better, but I haven't. Can you help me?
And we've created 2 separate environments. One was obviously the ER. One was more of a doctor's office or a clinic in a very large hospital. You'll see a little bit more of the virtual walk around. But the idea is that we develop the assets and turn them over to the university, and the university is able to change dialogue, add variety of test questions. You could use that same similar information to be much more, it wouldn't have to be on pharmacology, it could be on a variety of different geriatric types of things. Okay. Students had absolutely great feedback. They believe that it really helped their understanding of the pharmacology principles, and because they really were doing their graduate program at a distance, it provided a little more interaction. There were WebEx, there were different other types of things, but in terms of really feeling like they had that clinical experience, that provided that for them. Simulation is definitely the future, but that more static simulation is definitely not what we see the future to be like. Everybody has their own phones. You guys are all taking pictures and taking notes on your personal devices, and we see that that's what the nursing students are used to as well. They don't want to have to go home in order to go to their desktop, because that's the only place that that's going to work. So certainly in our military work that we do, they have tablets on the flight line. Pilots are using tablets in flight. Same thing here. We have a virtual walk around that I'm going to show you where the avatar patient as well as the avatar nurse practitioner can go up and pick up things in that clinical environment. And so any technology that they would be able to interact with in their actual clinical setting is something that they'll be able to interact with in the simulation. So if they needed to look up a diagnosis, if they needed to go to that electronic medical record, you're not going to have them step outside of the simulation, because that's not what they would be doing. They would be talking to the patient, and they would turn right around and have that information right at their fingertips. So whatever happens in the simulated environment needs to be as close as possible to what is actually happening at work. Otherwise, when you leave, there's negative training, there's confusion, and so you want to make sure that you do the same. Yeah, question?
Are you using that as one screen, or do they have the simulation on one screen and then they can do the patient record on?
It's all inside. It's all in one, because they really have to step aside from the realism or break the realism by going to an external setting. We did set up a lab for them that actually has mannequins. And so we actually have a lab with 3 different beds with 3 different mannequins where they do have their electronic medical records on a screen. But those are the undergraduate students, the live students.
Those are a different type, a different group of students. The on-ground students are not the same. These are all graduate level master's nurses who we generally see when they graduate if they decide to come to graduation.
They're not going to have...
So they're all remote.
Yeah, and they're not going to have a tablet with a live medical record at their house. I mean, they're just not going to be able to have that other thing.
And most of these are not nurse practitioner
Yeah,
students,
sorry.
but the course is this is for a nurse in the nurse educator track. So nurse educators, graduate level, yes. So this is part of their. It's housed inside. We use Moodle rooms as a platform, and it's integrated. Our instructional design team at the college worked very closely with Lockheed to integrate it right into our courses.
And is the what you showed, is that the assessment also? Is that how they're graded, or that's practice and then there's a separate assessment?
Well, there's a separate course. There's a whole separate course in advanced health assessment. These two are just examples from our pharmacology, advanced pharmacology and advanced pathophysiology, and they are graded experiences. They are.
Karen, did you want to talk about, because we had talked about turning the grading on or off, and you want to talk about the reasons why?
Oh, well, I mean, initially, obviously, we did, initially, we just did a pilot to see, obviously, how it's going to work with the IT, but also to see, feedback from the students. Ultimately, this is graded, and they are also asked to come back and discuss it in a discussion forum, the good, the bad, and the ugly, because we need that support, which is often lost, that sense of community with online learning.
And everything is asynchronous. All our online programs are asynchronous. We do not have lectures. We don't use any kind of synchronous experiences.
So it's all self-paced to a certain...
Well, it's 12 weeks. The course is...
finish in 12 weeks as fast as you
No, they have to finish in 12 weeks. They can finish, but they are required every week to post on discussion board. Yeah.
But the grades do report back to Moodle if they wanted to use that as a graded. So this is actually somebody doing capture of the virtual simulation, as I talked about, that can either be done on a tablet, an iPad, and so the idea here is the doctor, the nurse practitioner walks in, Joe's waiting. There's a computer over in the corner that could be interacted with should the clinician want to get some data. They're going to go up right now to pick up the iPad, and so all of those things are toggleable, just like a video game, right? And so that's definitely what our students all want. Not a beautiful view as the one we have out of the Sheraton here of downtown Boston, but we did put something out there. So Joe moves, talks, walks, interacts, and so anything can be done. We've been talking with the school about working and going into different settings, having multiple avatars, multiple patients, talking about triage, so the complexity can get as little or as much as needed. But the idea is really how do we engage those asynchronous online students. So,
Yes.
yeah.
Couple questions. What is your design tool, and what's the cost per course? Because I would imagine it's pretty high.
Yeah, I mean, I don't know that we're here in the sales business, and so that's definitely not why. The school and Lockheed Martin has a very long-term strategic relationship in terms of building simulations, we're helping them design their new simulation center, and again, it's got all kinds of the mannequins, and we have staff there and all of that. The true idea here is you can buy some things off the shelf and do the same sorts of things that we've done. That isn't necessarily customized solutions, because customized solutions are more expensive than off the shelf, and not everybody needs that. But the idea that you might get a YouTube video that might serve your purpose. So think about, because these Aspire sessions are really, how do you take what you've learned here to put it in your classroom? So how do you take some of those things and do more interaction with your students to bring them in? Yeah, I absolutely would not. I'm not here.
What is your design tool?
So in terms of, am I using, are you asking a technical question?
The avatar create?
Yeah, so we create in 3D Studio Max. We use ZBrush to do the facial recognition features. We have Flash and XML.
So that was all.
It's all customization. It's all custom work.
But like you said, you could pick up Storyline or something and
Of
do
course.
something much more primitive and yet
Right.
create.
Yeah, similar to the swivel, and yeah, we're done at 20, so I don't want to overspeak. But the idea is anything, you could do some of those things very cheaply, but to think about how do you incorporate a lot more interaction, critical thinking, self-assessment with those asynchronous online students.
And we've done in the School of Nursing, we've written a lot of grants to support this. You know, it is costly and moving forward, and it was part of our strategic plan to really step up the courses. Our online courses are really a lot text-based, so this is part of our move. And the community has been very receptive towards this. Not just the educational community, but the business community has really been very supportive. So I would suggest if, you know, that would be a way to raise some
I'm
of
with the College of Social Work, and our trauma certificate program is wanting to do some simulation type online training,
Right.
and you know, this is right there.
Right, and this is that is actually our next. We're talking about a disaster preparedness event for a public health course, public health nursing course. We have some things in there now, but not, you know, not like this.
Yeah. But really now with most of your learning management systems, you know, I heard somebody ask for OneNote. Are people using the technology that they have? Are your wikis, your blogs, your SharePoints, whatever it is? There are so many options out there that, in my husband's faculty at University of Central Florida, so I know, you know, there are instructional designers in there, but they're not always on the most cutting edge. And they're doing a great job usually managing a bunch of faculty. So hopefully you guys get some ideas here on looking outside what your general go-to spots are and thinking outside that.
Thank you.
Great, thank you very much.